Hello everyone, welcome back to my class. After the last lesson, today we are going to learn the key points of inquiry. Inquiry is a very important link in the diagnosis. Through inquiry, we can grasp the incidence of patients more comprehensively and perform syndrome differentiation and treatment more accurately, so as to improve the curative effect, shorten the course of treatment, and reduce the sequelae of injury. In the first part of the inquiry, we should ask about the general conditions, include the patient's name, gender, age, occupation, marriage, nationality, native place, address, date of visit, clinical history, presenter, etc., so as to establish a complete case record for access, contact, and follow-up, especially for the injuries involved in criminal disputes in traffic accidents, whose records are particularly important and detailed. The second part is to ask about the incidents. The first one in the incidents is the chief complaint. The chief complaint is the patient's main symptoms and time of occurrence. The chief complaint is the main cause and the main contradiction for the patient to come to see a doctor, which can promote the nature of the disease. The chief complaints of trauma patients mainly include pain, swelling, dysfunction, deformity, and contracture that have been discussed earlier. Chief complaints should be recorded concisely. The second one in the incidence is the pathogenesis. The patient should be asked in detail about the incidence and the severity of changes, the process of injury, the duration of coma, and adding coma again after waking up, treatment method adopted, curative effect, current symptoms, adding reduction or aggravation. The third part is to ask about the state of injury condition, include the site of the injury, and various symptoms include the condition of the wound. For example, we talk about pain. It is the most important symptom in the full diagnosis. The patient should be asked about the starting date, site, nature, and degree of pain. For swelling, the patient should be asked about the time of occurrences, location, scope, and degree of swelling. If it belongs to proliferative lump, we should know if it is pain first, as well as the time of occurrence and growth rate of tumor. If there is limb dysfunction, the patient should be asked whether it occurs immediately after injury or occurs after a period of time after injury. Generally, most of the functions are immediately impaired or lost after fracture or dislocation, while bone disease tends to affect the limb function after a period of time. If the condition permits, the patient should show his limb function by action at the same time. If there is deformity, the patient should be asked about the time occurrence and evolution of deformity. Limb deformity caused by trauma can occur immediately after injury or after several years. Congenital malformations or developmental malformations should be considered. It is an innate malformation or absence of trauma. Final, for wounds, we should ask the time of wound formation, contamination, treatment process, bleeding, and whether tetanus and antiserals have been used. In the third part, we should ask about the systemic conditions. First, we should ask about the temperature. Adhering to cold and fever are common clinical symptoms in traumatology. In infectious diseases, adhering to cold coexists with fever. At the initial stage of injury, fever is mostly caused by blood stasis. In the middle and late stages, fever may be caused by pathogenic virus infection or consumptive loss. The typical manifestation of osteoarticular tuberculosis is afternoon tidal fever. Second, we should ask about sweat. That is the excretion of sweat, so as to understand the status of qi, blood, and semen in the viscera. Severe injury or severe infection will cause cold limbs and sweating like oil. Night sweats are common in chronic osteoarthropathy, dorsal furuncle, and other conditions. Third, we should ask about the diet. The patient should be asked about the time of diet, appetite, food intake, taste, water consumption, and so on. Fourth, we should ask about the urination and stool. Constipation or dry stool is caused by blood stasis and internal heat. Elderly patients can lose motion due to insufficiency in fluid, resulting in constipation. Loose stools are mostly due to lack of yang qi or body disorders. For patients with spinal, pelvic, and abdominal injuries, we should pay special attention to the frequency, volume, and color of urination and stool. Fifth, we should ask about the sleep quality. Difficulty in falling asleep for a long time or sleepless all night is more common in severe trauma, upset, and internal heat. Lethargy but waking up at calling. Closed eyes and falling asleep again mostly belong to qi asthenia and mental fatigue. Lethargy with no waking up or lethargy once again waking up with unconsciousness is mostly caused by craniocerebral injury. The fourth part is to ask about other conditions, which mainly includes past history. In this part, various medical histories related to the disease should be inquired in details. The second, we should ask about the personal history. Includes the patient's occupation, some special hobbies, and for women about menstruation, pregnancy, breastfeeding history, and so on. We should ask about the family history in details. Include the health status of family members and whether there is a history of congenital familial hereditary disease. That's what we are talking about the inquiry. The last part of full diagnosis is pulse taking in the diagnosis of TCM. Through pulse diagnosis, we can understand and master the changes of conditions of qi and blood and deficient and chills and fever in the body. Of course, the content of pulse diagnosis has been learned in TCM diagnostics, and we will specifically analyze the different pulse conditions of different diseases in the explanation of specific bone injury disease later. But in orthopedics, it is palpation. It means examination methods for bones and joints. We will explain the examination methods for bones and joints in details in the next class. We have introduced the main contents of all the four diagnostic methods of orthopedics and traumatology of TCM. I think we will use all contents in the later study. So we will see you next time. Thank you.